Welcome to Kids Matter. I'm Dr. Elisa Minkin. As a pediatrician, mom, and grandma, I understand how challenging it can be to help our kids grow into their best selves. We are so much more powerful together. Here, I will be sharing the knowledge and wisdom of a wide range of people who understand and care deeply about children. I'm hoping for your input as well, because kids really do matter. They are our future. I am so excited to have Dr. Bryna Siegel, a developmental psychologist with a PhD from Stanford, who has been a leading voice in autism for over 40 years. Dr. Siegel co-founded one of the earliest US Autism Clinics and founded and led the clinic at UCSF for decades. She has headed 2 DSM field trial sites for validating autism diagnostic criteria and is the author of 5 books, most recently The Politics of Autism, published in 2018. She currently serves as the executive director of the Autism Center of Northern California, focusing on providing affordable, university quality diagnostics. Hi, Dr. Siegel. Thank you so much for doing this with me.
You're quite welcome. I'm excited.
I'm really excited. And I have to say that autism is everywhere now. Wherever it was in 2018, it's exploded in the public eye, but not necessarily in a way that I think we agree is particularly productive and is maybe counterproductive. So I want to start with the number one question I always get asked, which is, why is autism increasing? Not is it, but why?
I think that some of what the CDC is reporting, if we want to use that as our benchmark for autism increasing, is that the way autism is diagnosed and the methodology that the CDC uses to ascertain cases has a lot to do with that. The definition of autism now encompasses kids who wouldn't have previously been counted. So as someone who's been doing this for 40 years, I can meet a new family, a new child, and say, yeah, your child, we are finding today that your child meets diagnostic criteria for autism. But 10 years ago, this probably would not have been the label you were given, or 20 years ago, this would not have been the label, or 30 years ago. But I do meet kids who 40 years ago would have been autistic then and is now. So we have an ever expanding definition that includes more and more children. And that's the main reason. And some of it has to do with earlier diagnosis. A lot of it has to do with much later adult diagnoses, including adults who self-diagnose.
Yes, I want to talk more in depth about what is autism by today's diagnostic criteria. I don't think we have to go back and go through the whole history, which you do beautifully in your book, but I just want to start with what do we think of as autism now?
I think we need to be careful of why we need to be thinking of autism. There are what I would call 20 years ago, they would have been diagnosed with autism or under DSM-IV or 4TR, or the criteria we had prior to 2013 would have been diagnosed autistic. And those children have a certain set of needs and have what I've called autistic learning disabilities, specific patterns of learning that help them or result in them not attending to a lot of the information they're being given, either directly or incidentally from their world. So their learning gets attenuated based on their autism symptoms. They don't imitate. They're not interested in repeating things because for social praise that they get from family members and so on. And those traits of autism are really, to me, the core of what we need to treat. And we now are seeing more and more people getting the diagnosis who their feeling is that they're not getting the information, but functionally, we're not seeing them lacking in getting information in the same way that used to be requisite for given a diagnosis of autism.
One of the ways of looking at it is it could be that we're just diagnosing people with milder autism, which is truly autism. Another way is maybe we're over diagnosing it. So I want to go back and be really clear. What would you say the current DSM-V-TR, right? We're in the DSM 5th edition
Yes.
revised.
Yes.
How do they define autism? I want to be really concrete about this.
Okay. I think there's some important things there. I think that DSM-V has contributed to the continued broadening. Some of it came about when they had Asperger's in and then they took Asperger's out, and those people just became part of the spectrum. I think that just like we know that there are people who or have a tendency to depression, have a tendency to anxiety. I think we now know that there's a autistic like personality, just like there's an anxious personality or a depressive personality. And then the question that really hasn't been answered is, does that present the same adaptive barriers to life that having a full diagnosis of autism does? I think the people who have an autistic personality, if you will, do have harder time processing certain kinds of information. They react to certain things more extremely in terms of maybe being avoidant or being perseverative, but that by and large, they have channels of adaptation that allow them to function in everyday life in a way that people who have a more pervasive, if you will, not to go back to an old word we've now taken out of the DSM, a more pervasive form of autism symptomatology.
What I hear you saying is, oh my gosh, they are diagnosing people as having a disorder when they really don't. It's more like traits or personality. And I think it's a really important point. Where do you draw the line between normal, you're using that word with quotation marks, and autistic? And again, I'm going to use it in quotation marks. And at the same time, are we going to call autism a disorder, or are we going to call it a way of being? Those are two different things. And that leads into the neurodiversity movement. I'm not ready to
Yes.
go there yet. I'm not ready to go there.
Okay. Let's not go
But
there. But
I
I
know,
think
but
I can answer your question.
okay.
To answer your question, I think that we have tools in our autism treatment toolbox. And those tools might include things for a 4-year-old like ABA treatment, which is can be intensive, it can be one-to-one, it can be in some people's minds very rigid and depriving a child of their free will. And that's a tool in their toolbox that once you get a diagnosis of autism, it may or may not be appropriate for you. And so one of my concerns is that when we see kids who have, or teenagers or young adults who have more of an autistic personality, I think we need to be understanding what toolbox to use with them and what toolbox to be using with the kids who we would have always called autistic. And part of what's driving this problem is that most of the research money goes into looking at environmental causes, the genetics, and things that have to do with etiology. And we don't even have very good research in psychopharmacology, but that knowing who really benefits from tools in the autism treatment toolbox for kids with more severe or more pervasive forms of the disorder, and what are the tools in the toolbox that kids with more mild forms of the disorder should be getting. We don't have a clear definition. And in some ways, I find myself thinking more and more about, not that I'm not going to say an autistic personality, as I'm calling it, is not a problem, but we need to understand what kind of things benefit those people. Now, right now, that group, represented by the adults in that group, are saying we need to celebrate neurodiversity, period. And they're not really saying, how do we have accommodations that give that person a choice to not feel that their life is not exactly what they want it to be because of their neurodiversity. That there's lots of websites where people celebrate their neurodiverse superpowers. And I think that's just so much marketing. I think that it's great that we have people who are talented. We've always needed talented people to lead work in different fields, but to say that that's my neurodiverse talent, and therefore if there's anything about me that bothers you, it's my right to do that. I think that as a humanistic society, we've always had a desire to help people with maladaptive behaviors have the choice of being more successful across the board. And I'm a little disturbed that the neurodiversity movement is saying, I can be as quirky as I want to be as long as I have something that I can point to as my superpower.
I like to say.
Yes, go for it.
You went
I
through
want to
so
hear.
many things. I was like, wait. First of all, I'm a huge fan of the concept of neurodiversity when applied in the right way. And this is the problem I have with autism. It's if you're going to call it a different way of being, then call yourself neurospicy or something like that. Don't use the name of a word that's been called a disorder. Don't say it's not a disorder, because for so many people, it is impairing their function. And it's really, I get where you're coming from on that. But I love, and I'm finding it easier as a pediatrician, by the way, to make the diagnosis when the parents are feeling this is just a different way of being, and I will help them function better. So to me, it's not either the neurodiversity movement or the pathology. The
Right.
problem I have, and you said something else that I have a lot to say, I have so much to say, or forget it all. The other thing in terms of the neurodiversity on social media, and I think that there's some very problematic aspects. And I think the problem is when it takes a pathologizing view, right? And says, I can't help being this way. This is my way, and we have to accommodate it. I think it's a two-way street, right? And I think that saying that ABA is bad, which is what the neurodiversity movement are often intertwined with the anti-ABA movement across the board, when we know that it has the best evidence base when done.
And done for the right kids, done for the kids
Exactly.
who need to develop instructional control. They need to develop an instrumental way of reasoning. I'm going to have to do something to get something. Yeah, it becomes very functional, but I think it's been burned whole cloth, if you will, burned at the stake whole cloth by the many in the neurodiversity movement.
You know what's making it worse
What?
is the predatory aspect of the current ABA business. If
There
you
is
read
that.
about the Medicaid fraud and just crazy stuff is going on, bad ABA, in my mind, is worse than no ABA. And
Right.
so when they're saying ABA is bad and they can point to bad ABA, even for the right kid, that's still bad. But not, it isn't autism equals ABA. And I think that
Now,
was the point you
well,
made earlier.
and I think another, just, and this is almost a little bit of an aside, but I think the quality of most ABA that I'm seeing kids that I see receiving these days is by and large worse. And it's because ABA has always been an apprenticeship system where people who do good ABA have new people joining as behavior therapists, and they get a chance to watch and work with experienced and talented behavior therapists and understand, why are you doing what I'm doing? And what happened with COVID is that all the good ABA therapists went back to graduate school. They all decided, okay, I can't go into the home and do ABA. What am I going to do with the rest of my life? Now, this is forcing me to decide, do I want to be a teacher or a doctor or a psychologist, whatever, or is it time for me to start a family, whatever? And so I have now seen tons of ABA therapists who do in California. You have to do a 40-hour video program to become a registered behavior therapist. And a lot of them have no idea how to work with children because they haven't had anyone to mentor them and actually show them how it's supposed to look with a particular child. And it's if we were deciding we should build cars just by hiring everybody who lost their job during COVID or during a union strike, and now we'll teach a new crew of people to build cars by having them watch 40 hours of videos.
Do you want to talk a little bit about your idea of getting the parents more involved with the ABA? Because I did read about that in your book.
Yeah, part of what we do at the Autism Center of Northern California, it actually started as a program called Jumpstart Learning to Learn. And I actually wanted to call it Learning to Learn because I think that's key when parents get the diagnosis, is to realize that the child is learning differently. And I think often the reason parents bring their kids for diagnostic assessment, especially if they have older kids, is that he should be doing this by now. Or why doesn't he want to wear Superman big boy underpants? Because that's how I trained his two older brothers. They realize that the child is learning differently. And that's what brings them in for a diagnosis. And so trying to help the child remediate, and I don't mind using the word remediate, give them tools they don't have so that they can access the ways the environment teaches. A preschool teaches by assuming that you want to do what the other kids are doing. We're all going to do the hokey pokey and put our right hand in, our left hand in, and so forth. And the reason kids do this is they like, I want to do what everybody else is doing. And if you have a problem with your mirror neurons and you don't have any, like, why would I want to do this? Then you're missing out on learning opportunities. And so to me, parent training is pointing that out to parents and looking for what we call the teachable moments. When are things where the parent wants the child to do things that they're motivated and okay, if I have to do it your way to get what I want, I get it. Okay, so it's not so bad. I'm motivated. I get what I want. If I have to touch the refrigerator or the picture of the yogurt cup on the refrigerator that's pasted there to get my yogurt cup instead of kicking the refrigerator and crying, hey, I'm getting my yogurt cup quicker. I'll do it. And so we want parents to find those moments and use them because then it's learning to learn. The child is learning to learn. And that's the core deficit. And the parents have all the best opportunities to provide opportunities for the child to engage in that.
I'm going to also say that I wish that there was a way to help parents build a team because as an autism mom, we're tired. We're overwhelmed. I thought reading the book that you were saying parents should do more of the ABA, or I know you weren't saying that.
No, in fact, I think when I see parents doing ABA, it's you've got enough on your plate already. Stop doing that. There are other people who can do that. And especially because I think that ABA therapists commonly will tell parents, you're going to work on generalization. But what they really mean is that just do more of what I'm doing. And the child actually needs to be able to use that as a database to use maybe vocabulary he's been introduced to or cause and effect he's been introduced to make new things work for him. And the parent can do that, but the parent is also not the teacher. In fact, when I've been in situations where there's very little ABA available in California, we have a lot of people in very rural areas, for example. I'll say to the mom, get yourself a little smock or apron. And when you're going to sit in a little room at a little table and do what the ABA therapists do, put on your mom ABA smock. And when you finish, take it off so that there's a way of saying, we're not at the table anymore. I'm not at my smock anymore. And we'll do things a little differently now. And I think we could, not a discussion we'll have today, but I think some of the problem with homeschooling is this, that there's not enough of a clear delineation between being a teacher and being a mom.
Yes, and again, I'm still having problems with the idea of a parent having to take on a teacher role as opposed to empowering the parent to help raise this kid best
Yeah,
with their
no,
autistic brain.
no,
I don't
they
think they're the
have
same thing.
no, not at all. And you're absolutely right. And that the parent needs to be the parent of an autistic child. What motivates him? We use both ABA and also what some people would call PRT or DIR or floor time or Hannon. There's all these different approaches, but a lot of them have more to do with using what naturally motivates the child as your instruments of teaching. So if you want kids, some kids are very interested to learn their colors, their numbers, or their shapes, but some are not. Some of them just want to run up trains or matchbox cars. And if they do, that's where it's at for them. And I always think of it as the thin edge of the wedge. How do we start where the child is at and show them that what interests them belongs in a bigger world of objects or activities that because they find a train going around a Thomas track interesting, there's a bunch of other stuff that is related to this. There's other kinds of tracks, there's other kinds of vehicles, there's making yourself into a train that goes around a track. There's a lot of different things that the child can do that help develop their conceptual thinking so that they have the capacity to generalize and become more abstract. And parents, it's not so much what parents have to do, because I'm very mindful that one of the problems is that parents who have an autistic kid are always guilty that they're not doing enough and that they should be doing more. Or he wants to just lie with me with his head on my lap and watch TV now. That's beautiful. You don't have to be making that into a teaching moment because
Everything
there's
doesn't have to
nothing.
be teachable.
Everything does not have to be a teachable moment. You can grab them when they happen, but I think that we haven't gotten there in our conversation, but a lot of what I do with parents of older kids is when we're starting to look at prognosis and where is the kid going and how has he responded to the intervention that the child has. Some of it is what interventions the parent has been able to line up, but some of it is what the child's been able to take from what's been lined up for him. And this is some complex interaction, and it means for the parent, it's not that you chose the wrong therapist or you didn't sign up for enough hours of it, or you didn't fight hard enough for more of this in addition to that. But this is who your kid is. And I think I mentioned this to you when we've talked before, that to me it's like signing your kid up for piano lessons when they're two, because you think that being able to play piano for you as an adult is a wonderful release and involvement and engagement. There's nothing bad about it. It makes my brain better. And after the child is 4 years old and has had 2 years of piano lessons, the piano teacher might say, he needs a better piano teacher than me. But the piano teacher might say, I think he'd rather be on the softball team. You don't get to choose that your child is going to be a gifted pianist. And disability is the same way. You don't get to choose that your child is autistic. You embrace who they are and how they can do things.
I love that you embrace who they are and how they can do things. And I think that's one of the cruxes behind argument against ABA is that it used to be, this is going to cure your kid. This is going to make them not autistic. And I think some of these people who are advocating against it went through ABA
Yeah,
in
they're
those times.
I think exactly. Yeah, I've talked to some of them. Yeah, and there's a couple that I remember when they were in ABA, what their ABA programs look like. Yeah,
It's normal for parents who have kids who are significantly impacted by autism to want them to be cured. And I'm putting that in quotation marks because it doesn't mean that they are anti or they're autistic phobic. You know? It means they just want their child to succeed in life like everybody else wants their child to succeed in life. And it's a process to get through that phase, right? It's a phase.
let's break down what you just said. So I think yes, parents want their kids to succeed in life, but there's really one component, which is parents want their kids to be happy. They want their kid to feel like they can control their environment, that they are not adrift in frustration. And so some of it, and we've again talked about this, when we think about teaching kids activities of daily living, where the child now has independence and has freedom from I'm hungry and I don't know how to get something that I am picturing that I want to eat, that's happiness. And it's not success in the same way as will he ever go to college?
Right. But when you're a parent of that toddler, you're thinking, will they get married? Will they go to college? Will they have
Yeah,
children? That's
right.
your definition. And you can only change your definition of success for that child through a very long process.
Yeah, I agree. Yes, but it's also true of all your typically developing children. Okay. So, of your typically developing children, and how many kids do you have? You have a number of
Six, thank
kids.
God, yes.
Six. Okay. You have six kids. Maybe the one who you thought was the brightest 2 year old is not earning the highest income as a young adult. And maybe the one that you thought he's pretty good, but maybe he went to law school. We don't get to choose who our kids are, and we understand that some who went to law school, they should be married by now, the other four are married, but everybody is growing up and defining their success in a different way, and we really want, and we don't know, as a 2 year old, we don't obsess, is this the one that's going to go to law school? Because my husband's a lawyer and I've got six, at least one of them has to be a lawyer.
Yes, we might.
You mind? Okay.
So I love that so much because that was the lesson. That was the gift that my daughter with autism gave me very
Okay.
early on, the whole redefinition of success.
Yeah, I get for you, I use the example of law school rather than medical school
Thank you.
because, yeah,
That would not be a definition anymore.
mhm,
Sorry.
right. But
No, but
yes,
like to love your child and to let them be who they were meant to be is true for all children. Someone once said that parenting children with special needs or disabilities or whatever word you want is just like parenting typical children, only more.
it is more and different. The things that you want to do and how many times a kid might be just tickled pink to do the same thing over and over again is different. And it's just going with let's get him tickled. But on the other hand, there's also a balance, and kids who don't want to do their homework or don't want to study for the test, parents put a little pressure on the kid. I think you'll feel great if you get the highest score in the class, and I think you're smart enough to get the highest score in the test. So let me quiz you on a few more questions. And so the parent tries to motivate that child. So there's nothing wrong with motivating your child, but there is something wrong with what people who hate ABA call kill and drill and kill.
And ABA has changed to be much more naturalistic when it's done in its ideal way.
That's correct. Yeah, it has
Yeah.
because EVAR, we've lost EVAR who started it, and a lot of EVAR students have been more the people who saw what he was doing and thought it was brilliant, but they also thought it could be made more natural. And that's some of the work that we see from Laura Schreibman, who was head of psychology at UCSD, and Bob Cagle, who ran the Cagle Center at UC Santa Barbara. And there's people in Florida, there's people all over who have been doing this more natural stuff who started off working for Ivar Lovaas and doing it just the way he said, but branched out.
You alluded to other methods. For some reason, ABA is the only methodology that has some evidence base behind it. I'm not even sure how strong that evidence base is. We've been so busy, this is what you talk about a lot in your book, with other priorities.
Yeah,
I don't
well,
know how much research we've done.
there's not enough research. There
Yeah.
hasn't been enough research on responder characteristics to ABA. I mean, as a physician, as if you are you doing off-label prescribing of a psychotropic medication, let's say an SSRI, to a very anxious 4-year-old autistic child, you're going to look carefully about whether that's helpful and the way in which it's helpful. And the next time you see a 4-year-old anxious autistic child, you're going to think, why do I think it was so successful with that first kid? And if that second kid doesn't have that same cluster of traits, you might say, let's try something else first. We're always trying to learn from from response to intervention. And there has been a paucity of response to intervention. And quite honestly, I'm tired of hearing people say ABA is evidence-based and therefore everybody should get it. Because yes, it is, but there hasn't been enough research on who the responders were, even after all these years. And so a physician, a parent needs to look at a particular child and who's in ABA and say, I think we've gone where we can go with this, not just if he's not responding, the answer is to do more. And for a number of years, that was how ABA was used. And I think that's where some of the people who hate it so much now, that I remember years ago, I was in New York, actually in New York City at a very early Department of Public Health due process hearing where a parent was suing for more ABA. And I was actually the expert witness for, I don't think he needs more of what the parent is saying. And it was because this was a 2-year-old and they were doing things like the child would fall asleep in his chair and they would just gently tap his cheek or even pinch his cheek to wake him up. And I said, a kid who wants to be asleep is not benefiting from intervention. He needs to be asleep. Or they wanted to have the mother do 10 of the 40 hours a week that were then de rigueur. And the fathers argued that that was slave labor, that his wife was not being paid and he was not going to stand for his wife being a slave. Yet we then learned, as research proceeded over the years, that the extent to which the parent is aware, and probably a big unmeasured effect of what Lovaas did initially, was that he had the kids get 40 hours a week for 1 year from his graduate students at UCLA. And then the parents had to leave and go back to wherever they came from. And in the process, the parent had been trained to do ABA so that when she went home, she could hire more therapists who knew what to do and she could teach them. But that meant that the parent finished 40 hours a week and took the kid grocery shopping. And if they'd been working on colors and they were going past the tomato cans, she'd ask, what color is that? And that it was like this thing where it's not just touch red and get an M&M. It was like, it's red. That was built into what he did, but it was totally unmeasured. But it was what every mom did if they were having to do 10 hours of it. And it happened just naturally, incidentally, and it was an unmeasured effect.
It's really important to keep in mind that more is not necessarily more.
More
And
is
that
not better. Yeah, more is not
autism,
better of anything.
yeah,
More,
yeah,
it's just
autism
it's
doesn't,
dose
sorry.
response. It's dose response, just like any medication. It can be very effective, and you say this is working great. Let's take it up higher, and you take it up higher, and you don't got something good anymore.
And not every child is going to be appropriate for the ABA methodology.
Right. Right.
And I think one of the problems is as we're diagnosing a wider and wider spectrum, and you get credit for using the autism spectrum as a term, pretty much
I
one of the
think
first that it was
I
your
think
book that was
I
my
think
favorite
so.
when my daughter. Yeah.
Well, I think that book, which came out in 1996, I think was the first book that had the word spectrum in the title,
Yeah,
actually.
that was very helpful for me because when my daughter got diagnosed, it was still the PDD, Asperger's, autistic disorder trio. And it left kids like my daughter, who were in what I call the muddled middle, out of actually getting autism. What I'm trying to say is we are seeing true autism, and that's why the rate is rising in part, not that we are not seeing it. Is there some overdiagnosis, especially self-diagnosis? Yeah. But I will say, as a pediatrician, I see more missed diagnoses, particularly in the older kids, because they're not as clear cut. Then I see kids being overdiagnosed.
I see both. We see a lot of teenagers, but most of the teenagers we see, and that's because since I left University of California, I'm now working and I've started a private clinic where I'm trying to develop a model for providing high quality care to low income Medi-Cal, Medicaid families in California. And we do it by linking it with a training program for new clinical psychologists who aren't able to be paid but need to be supervised. They have their supervisors there all the time. And I think we're seeing a lot of immigrant families who come in with teenagers who, because they've come from elsewhere with them, and especially come mostly, we're seeing from Latin America, countries that don't have resources for diagnosing or serving autism. We're seeing kids like that that you could say they've been missed, but if you're 14 and you're coming from Honduras, it's not that you were missed. It's just there ain't no there in terms of diagnostic services. Um, so yes, but we're also seeing a lot of parents. I think I recently read that 26% of kids enrolled in Ivy League colleges have some kind of accommodation that they got into school with the idea that they had some kind of ADHD or autism spectrum disorder, that accommodations needed to be made available to them. And I'm not sure that that does much. I'm not sure I agree with that. I think we have a lot of functional ADHD that comes from the amount of time that kids are spending on the internet and on FaceTime. I think Jonathan Haidt's new book about this is amazing because it's true. We see these kids who can't learn without a laptop. We have Scott Soloway talking about how young men watch so much porn on the internet that they have no idea how to ask a girl for a date because their model is awful and they become very solitary and socially unskilled. I think, is that autism? When we get a developmental history that this 18-year-old has never been on a date with a girl, but he does spend a lot of time on the computer. So the parents are interested in how can he have a career with computers? It's really complex.
I think it's a chicken and an egg, first of all, when you're talking like that. It's hard to
Yeah.
tell,
Yes,
number one. And number
absolutely.
two, I do
I'm
think
glad you said that.
yeah, I think societal factors are pushing the spectrum from normal. And by the way, I'm going to say this loud and clear. This is, as I understand it, the spectrum blends seamlessly into normal with all
Yeah.
shades. And the problem is, if you think of shades, green turns into blue gradually. How do you define is aqua blue or green? And I think a lot of what used to be called the shadow syndrome or broader autistic phenotype in that middle gray zone, people are now saying is
Oh,
autism.
it's all those, that is all autism. The
Right.
broader phenotype is autism. And I think some of the current diagnostic scene comes from that. Okay. In particular, I can refer to the ADOS and the ADIR, the two main tools for very comprehensively diagnosing autism. And we use the ADOS. It's okay. I don't love it, but why? Um, it started, Kathy Lord was, I believe, doing a postdoc at that point with Mike Rutter, who was a very famous child psychiatrist who had done the very first study that talked about the genetics of autism. Him and Susan Folstein, who would a student of his, had looked at identical twins and dizygotic twins and saw that at that time and in that sample that 95% of if one monozygotic twin had autism, the other one did. The one dies if they were monozygotes, both of them would have autism, and that the it was like 15% for the zygotic twins. And oh, wow, this disease is genetic, is really genetic. And that got Mike Rutter into, or he then became Sir Michael Rutter, got Dr. Rutter into wanting to look at that broader phenotype. He was the one that kind of coined the concept of a broader autism phenotype. And the ADIR and the ADOS were designed to encapsulate that, to be able to sample for traits that, especially the ADIR, this 2.5 hour long interview, catching who were those broader phenotypic parents, but also kids with the broader phenotype. And that's really what kind of opened the door to starting to think about it as a spectrum.
Yes, and I think about when you're calling autism as an autism spectrum disorder, sorry to all the neurodiversity folks who get upset about that, but we're going to use it as a disorder because that's how clinicians use it.
Yeah,
The
no,
key is function, it's function. And I'm wondering whether societal factors are causing more people to have functional problems. If you think about it, say you grew up on a farm versus in today's fast paced, social media driven society, there's actually something called, what did they call it? Screen autism or something like that. There's
I haven't
actually a
heard that one.
term. There's something, it's not the right term. It's something, but it means autistic like pattern that is really just due to overuse of screens early on. And if you
Wow.
take away the screens, they no longer look autistic.
So we certainly see that in kids we see in the clinic. The parents want to let the kid have his iPad in the room with him, and the child might actually interact and interview. I had a little bit of a disturbing conversation with a mom who's a clinical psychologist at the end of last week because she felt that we missed the diagnosis of autism in her 17-year-old. And in fact, he's like a big screen time guy and not too much in terms of real friendships and all of that. But in a room alone with the examiner, not with his parents, and we were all watching on video, he was very articulate about social relations and how he feels about people defining who's a friend versus an acquaintance and what makes someone a friend of his. And he had it. But if you hand him back his iPad, he's a sort of sullen one word, maybe I'll respond, maybe I won't kind of guy. So I believe that might be what you're describing. Yeah. And so there's that. There's also that. But it speaks to, in a way, it's almost like a canary in the coal mine. It speaks to what can go wrong, what's going to functionally be an adaptive problem this young man can face. And I would have loved to talk about it with the mom, but she felt that absent agreeing with her that he was autistic, we obviously could do nothing for him.
It's hard because there is no clear line.
No, there is no clear line. And therefore I've always, in all my work in talking, not in the politics of autism, but in my book, Helping Children with Autism Learn, that's why I chose to call it autistic learning disabilities and autistic learning styles. And if you have an autistic learning style, how do you help kids utilize that as well as they can to adapt well? And if they have autistic learning disabilities, how do you use those autistic learning styles to help them overcome the autistic learning disability so it's not a limitation? And I think it's very complex and it hasn't been unpacked. That I think part of the insistence on in the neurodiversity movement in celebrating neurodiversity or if we're talking about Superman powers and so forth, is to say that there's something really good here and you don't want to throw out the baby with the bathwater. And, I think a good example I can give you of that is many years ago, I was on the board of an autism nonprofit. And we were very happy to have join our board a prominent Bay Area autism celebrity who was a guy named Art Shallow. And Dr. Shallow had won the Nobel Prize in physics at Stanford for having developed the laser beam in the 40s or 50s or something like this. And he gave all his money to develop a group home for his son with autism. And he was what we call the broader autism phenotype. I remember him coming into a board meeting and one of the men from the men's room and one of the men on the board pointing out to him that he hadn't zipped up his fly. He had the prototypic top of his pants showed some of his ankle before his socks began. And he even went so far as to bring a very nice camera and want to take pictures of his fellow board members so that we could write our names on the back, because he said he wasn't very good at recognizing faces, which is part of all that's been written about the fusiform gyrus and for facial recognition and autism and so forth. It was totally there, but the guy bloody invented the laser beam. So yes, he had superpowers that other people didn't have, but socially, he was a very sweet guy, but he was not socially skilled. No one was going to turn him into a diplomat.
He sounds like what we used to call Asperger's, which we've lost that
Yeah. And
title.
so he was able to succeed in life because if you're a physicist, actually no one expects you to be particularly socially skilled. That I have met many kids who have dads who are physicists, and you know, down to a single one of them, all their other friends are other physicists who, when they get together, they talk about physics. They are broader autistic phenotypes, but they are able to make a good adaptation. I've had dads where I've thought, starting to talk to them, maybe they had mild intellectual disability. And I say, "What do you do for a living, Mr. Whatever?" And he says, "I work for NASA Ames. We're working on developing satellite guidance systems." Okay, he doesn't have mild intellectual disability, but second hypothesis is that he's the broader autism phenotype, accounting for why he has two autistic children.
But
Yeah.
you're calling broad autistic phenotype, but I'm calling milder autism. It's
Yeah. And that's
semantics at some
it's
point. And
totally. And we don't talk about the broader phenotype anymore. We just talk about those people as being on the spectrum.
so,
Exactly.
right, I think it's a double-edged sword at the milder end, and where it shades into what we call normal. You could say, what is normal anyway? And this is why I like neurodiversity when spun the way I like it, which is to accept that we're all different. Our brains are different, and that differences are wonderful, and you can celebrate your quirks. It's why not? Why are we even? The problem I have with the neurodivergent versus neurotypical dichotomy, I'm ND, I'm NT, is first of all, neurodivergent implies divergent from normal, that there is some set normal, as opposed to diversity, which is that we're all different and that differences is cool. And we should bring those differences together, as opposed to neurodivergent meaning a pathology.
So,
And
so some of the neurodivergence can be pathological. Some of what makes you different can make you quirky. It can make you talented at certain things, and that's great. But there are people who are neurodivergent who have very average abilities and can do average things. They can take the bus and they can microwave burritos and quesadillas, but don't have any special talents, but also have autism traits that are impairing their ability to integrate with larger society. And to say that, yes, you're neurodivergent doesn't mean you don't need treatment for the things that are holding you back and helping you have a more adaptive way of functioning. And I think that the neurodiversity movement is running roughshod over that.
they're minimizing the disability, which by the way can happen even at this highest end. And
Sure.
that's where I think we are very helpful for the most part when we diagnose more mildly impaired people with autism, because we're giving them a chance to learn their strengths, learn their weaknesses, get help for the weaknesses, be able to verbalize it, get the supports they need, even at this mildest end. But I want to bring this up. I don't hear this talked about, is there's also the nocebo effect,
The
right?
what?
And the nocebo effect. We have placebo,
Okay.
right? Where you take a pill and you think it works, and it does work because your brain makes it work, right?
Right.
That's a terrible description of placebo, but most people know what you mean by placebo.
Right.
The nocebo is not talked about as much. And that's sometimes if you get an autism diagnosis and you thought you were normal and now you're not. For example, it really hit me when I saw a video of a young man and he was saying, I really miss my pre-diagnosis days because I had so many friends. And then I just realized I was masking.
Yeah, that's terrible. That's terrible. And
Well, to
that's that
cry.
and yeah, that really worries me. That I think there are some people that I've met who feel like they need to act a little more autistic to validate their neurodiversity. I've been at conferences where there are high functioning autistic people, and I think once it wasn't a podcast, but I was doing an interview for somebody, and this high functioning autistic person walked in and said, I'm supposed to be here for an interview. And you're not supposed to be in here. Get out. And people said to her, we're interviewing me, go check the schedule, go to the media room. You'll see that we made some last minute changes. And she said, I'm autistic and I can't, it makes me I have to engage in my stereotypies and I can't deal with change. So you just need to leave so that I can do my interview. And she was like, I felt like she was kind of, let me show you that I'm on the spectrum and maybe that will be a way that persuades you socially. And the people interviewing me said, Dr. Siegel, you're the autism expert. What should we do with this woman?
I mean, it's a balance, right? That we can accommodate a lot and understand a lot, but it's a two-way street. This is what I love about Temple Grandin, by the way, is she really is the role model
Yeah.
of understanding and being sensitive to your artistic differences, but learning how to function in neurotypical society.
Right. Yeah. No, she has a very, it makes her very practical in a
Yeah.
nice way. Once I
Yeah.
was giving a talk on a panel with Temple, and as we all know, if you go to an autism conference, there's usually many more women attendees than men. And there was a break, and there was a big line for the ladies' room. And Temple walked up with a sign that said ladies and a roll of scotch tape, and she taped it to the door of the men's room. And she said, all the women shouldn't
For
have
me.
to wait. No one's using the men's room. There's a men's room one floor down. If a man comes, they can go one floor down, and the rest of you.
I love her. I love
Right,
her.
right,
She's amazing.
right,
She's really
right,
amazing. I can't believe we've been talking
right.
this long and we haven't talked about the politics of autism. How did that happen?
Okay,
That's what
okay.
your book's about. I have to give you a chance to talk about that. I'm going to give a quote. The politics of autism are the slant that filters information and provides us with what we will probably like. And this has led to misguided priorities that have left behind the real needs of individuals and families living with autism. This is really important. So we need to talk about this.
Okay, absolutely. Great. Yeah, I think that one of the things that is a big issue in our diagnostic clinic that kind of starts to get to this is that, you know, when do we know what we know? If we see an 8-year-old child with autism that's had ABA since age 2 and they're still not reading, they can recognize 18 out of 26 letters of the alphabet on a good day. And they do know their colors, but they still get confused counting to 20. Do we continue to beat that horse or do we look at what that kid does well and think about how do we work with that? The kid may be totally interested in transportation and knows the names of all kinds of transportation vehicles and knows how they function and what their uses are. And for me, I would rather see that child, parents thinking about kind of apprenticeships where he gets to do stuff like that. But there is a point at which clinicians can see where a child is headed. And for me, and I always tell my staff, it's not for me to know and keep it a secret from the parents or to shine them on and say his IEP, you won't have to discuss for another, he's 14, you won't have to discuss until he's 16 whether he's going to get a certificate of completion from high school or whether he'll get a GED equivalent. If he really doesn't know all the letters of the alphabet yet, he's on a certificate of completion graduate, and we need to start forming a picture of he can have a good life, but what is he going to do? And what could you start doing now? Because I actually think that it is child abuse to continue trying to teach that kid the alphabet in most contexts. That if I can't learn something, why are you going to beat a dead horse? Why are you going to insist that I learn trigonometry? I don't want to learn trigonometry. I don't see any point for me to learn trigonometry. And you could lock me up with some people who are going to teach me that, and I would be unhappy and I would have negative behaviors and I would not try to run out of the room or be physically aggressive with the trigonometry teachers, but I would take my mind elsewhere until this was over. And we have kids that do that when you're trying to teach them the letters of the alphabet, 6 years on to teaching them the letters of the alphabet. You're providing them with stuff that it's not where they're wired up. So let's pay good attention to how they are wired up and let them flourish in that domain, not beat a dead horse. And parents don't want to say my kid can't read, but there are kids who can do some really good things and who don't necessarily need to read. I'll use it as an example. We actually used it as an example in the clinic the other day, that if for anybody who's traveled to Mumbai in India, there are these guys who have been studied by FedEx and UPS who deliver tiffin lunches to office workers in Mumbai, and their wives cook their lunches, put them in these tiffin boxes in a cloth stack that has some markings on it, and somehow they get picked up. They get all bicycled to a certain location, they get sorted, and everybody gets their right lunch and can come home with their empty tiffin box. These are illiterate people doing this. And it just goes to show that, oh my God, my child is going to wallow in a life of misery if he can't learn to read. The question is, how do we help parents feel good about saying, what else should I be doing to help him develop his relative strengths at this point? Not that you failed your child by you should have had him in a different school, or you should have had more ABA before he started kindergarten. You could say all sorts of things. And as you were saying earlier, you don't have to encourage a parent of an autistic kid to feel guilty about their parenting. And because it's so easy to do, I think we as clinicians shy away from anything that might make the parent feel guilty, but we shine them on as to what is happening instead. And then you have the little yellow school bus metaphor, the parents of the 18-year-old saying, what am I going to do next year? The little yellow school bus isn't going to come to my house anymore. What is he going to do all day? And it's tragic. It shouldn't have come to that.
It would be 22, I believe, if you're not getting a high school diploma.
Yeah,
Some of these kids, by the way, are able to meet the criteria for a high school diploma at 18 and yet not utilize it because they have good road skills and they're being taught the test. And
right.
even
And then
those kids don't necessarily do well after high school. They graduate to the couch.
absolutely. And there's a whole group of them. And the parents look at what you just alluded to, the 18 to 22-year-old transition to adult living program, and they say, doesn't I looked at that, and like a lot of the kids in there are nonverbal, and my son reads, and maybe he mainly reads manuals for video games, but he reads. I'm not going to put him in a class with people who don't read and who are learning to put their dirty dishes in the sink. There are kids like that, and they absolutely need it. They shouldn't be like in high school, and they shouldn't be 19 years old before we start teaching them that. But yeah, so we don't have a place for the guys I have a lot of them who in California, we have a lot of disability learning centers in our community colleges, and the kids take courses in community college, and typically they start off, they take 4 courses, they drop 3, they marginally pass 1, they take it again the next semester, they take 2 more courses, not 4 this time, but 3. Next semester, they take 2. After a year, they've passed 1 course fully, and they are at home on the couch. And it causes parents to infantilize them, to really like suddenly crash their expectations. I have one family that I've seen that they have 3 kids like this, and one of them has been in community college for 10 years. And the mom spends her day driving them back and forth to community college because they take different classes on different schedules, and picking them up on different schedules, because having them take the bus or make their own meals when they come home it's like she's running a group home. And she's really trying hard to get them to, if only they could finish these courses and maybe they could work here, work there, but they need a new plan. And it's really hard. And there's not resources to help parents make those plans. There's only resources for the ones who end up not needing plans like that. And I think that the community of they're no longer the broad age phenotype kind of people who are now embracing the autism diagnosis are actually pretty insensitive to the fact that there's a bunch of people like this.
That was possibly the part of the book that resonated the most with me as the parent of an autistic adult. It is so hard when those school services end, but also the school services are geared towards the academics. And I don't understand, not everybody has to go to college, even with typical kids. They're talking more and more about the high unemployment rate of typical young adults. Those
Right.
without autism, the ones with autism, I think it's 90% are unemployed. It's insane,
Or
even on the higher
underemployed.
end,
Right. Yeah.
right?
Or they're
Way
employed
underemployed.
And yeah, or they are in volunteer positions, or they only are paid a few hours a week. It's tragic. And I think there's a lot of things there are all kinds of jobs. And I'll suggest some of these jobs to parents. I've had young people who, work in a group home for severely intellectually disabled people because they need someone to help them get their shoes and socks on, help them get in and out of their wheelchair, push them when they're in the community in their wheelchair, get them on and off of a kneeling bus. And they can do those things and they feel proud that they're doing something functional. And they don't have to do it 40 hours a week for it to be a successful job. But they feel like they're helping someone else and they're aware that I have a disability. And boy, a lot of people have helped me. And I actually feel really good that someone less able than me, I can help. I have young women who, work in assisted living facilities where they can just sit and be a companion to some older woman with dementia and hearing loss, and just sitting next to them and being company and maybe doing something when you're just with them it's a mitzvah, it's a good deed. And they understand that they're going there to help Mrs. today. And maybe they take her for a stroll around the grounds or whatever. But those are jobs that people with autism and significant adaptive problems of their own can and should be doing because society has a need for them. But we don't encourage that. That's not a career. It's not a job identity. And I think that we need to get back to the thinking where, you know, if we think about our great grandparents, they would have 5 children and they maybe would have one who they said, he's going to be the scholar. He can go on and study further, but this other one needs to come and help me in the shop. And this other one, we're going to send him to Uncle so and so who has a farm because he can collect eggs. But it was just that was the realpolitik of dealing with the fact that you had kids with different capacities. And we don't have a realpolitik for that anymore.
No, we think college for all. And this is a problem not just in the autism roles. Remember how you said in the beginning of your book that the issues with autism are a microcosm for larger issues of society. This is
Yeah.
what this article was saying about the 60% unemployment rate in young people after college. They were saying about someone who was an immigrant and they wanted their child to have this amazing job. And they said HVAC and pool and whatever. And she said, no, I want my kid to be the kid at the pool in the backyard, not building the pool. To
Yeah.
deal with that. It's a reality that people have these hopes and dreams for their kids, but just
Sure.
like we have to be real about everybody, we have to be real about kids with autism too, to help them, and we have to build on their strengths. I mentioned earlier, building on strengths, and that's unfortunately not what we're necessarily doing
No,
in the
we're
school system.
not. And it's very hard to train young clinicians to feel like this is going to be part of your job, not just telling the parent whether or not their kid is autistic or their score on 7 different standardized diagnostic measures you've administered, but what does this mean for how your child can succeed? And I think part of the reason we don't have more research on treatment outcomes from different kinds of career paths or different kinds of interventions or different kinds of training activities of daily living is because we're aimed at the fact that's really what we should be recommending for some parents and telling them that maybe thinking that your kid is going to go to college, I'll let that be someone else's job. And I think it's very hard for educators. I've done a lot of work consultation to school districts, and I'll work with special ed directors who will take me to a high school class and they'll point out kids that they've known since they came to the school district when they were 5. And almost always there's, oh my God, I thought she would be doing so much better by the time she's in high school. Because I remember when she was 5, she had memorized 85 Sesame Street songs. And, it's like teachers, the problem is that teachers by and large only have a cross-sectional knowledge of kids. They know everything about first graders or they know everything about second graders. And they really don't know developmentally what the kid is going to look like 5 or 10 years later because they're not a high school teacher or a middle school teacher.
And who could be the person to help the parents with this?
I think it should be part of people who do diagnostic work in autism. And I think that one of the things is that, and I talk about this in the Politics of Autism, is that we have not created a medical home for kids with autism. And that is as a pediatrician. A medical home, we usually think of it, that's for the diabetic kid or the kid with cystic fibrosis. They absolutely need a specialist pediatrician that before we make any diet changes, before you send them to summer camp where there's ragweed everywhere, you're going to need to touch base with your medical home to see if that's a good decision for your child. And if their insulin metabolism becomes destabilized, you need someplace to go back, not just saying, what do I do now? And kids with autism need a medical home. So, in my experience, none of the diagnosticians I know do medical home. They're not trained to, we say to the parents of the littlest, your kid is 23 months old. You need to come back to us before he turns 3 and enters the school system, or before he turns 5 and enters the school system, because I don't know yet. We have no response to intervention data. Your kid has received nothing. You just got the diagnosis today. And in a way, it's your low point. And anything you do from here is only uphill. But I don't know what that trajectory looks like until I see him again. And then we can start fine tuning what kinds of interventions are going to be more specific to what we see gets learned easily and what doesn't get learned so easily. And we've never trained autism clinicians to do this, but we needed a medical home for kids with autism.
We needed to pay.
Right.
Okay.
Right. We need
Developmental pediatricians could do that, and
yeah,
they're not.
absolutely. No.
They're becoming the dinosaurs because they're not getting paid as well as even pediatricians, who are some of the lowest paid clinicians. And pediatricians do not have time to do this.
No, and there are no CPT codes for it. I, as the head of a agency that sees autistic kids, I fight with these people who tell me that there's no CPT code for that. You don't, right now I'm in a battle with Medi-Cal about why do you need to get a developmental history before the kid comes in? We need to know what the parent thinks is wrong. We need to think what their understanding is of this behavior and what they're trying to do about it, and where it came from. And we need to know what level the child is at so we know what measures we're going to use with this child. You need to know it's not part of, let's sit down and try to give you a whisk. Wait, you don't have enough language. Let's give you a whipsy. And well, you can't use that code to do that. It's basically, some of it is the insurance companies. If we limit the number of codes that describe the activities of support, then we'll have fewer activities of support going on and it will cost less. And that's the deal.
It's more than that, though. It's also the whole way the reimbursement setup is to give more money to procedures and medications and stuff like that, and not to spending time talking to people and counseling.
Right.
And all the
right.
CPT codes in the world, if they don't pay, what good are they? No
Yeah.
margin, no mission. This is where
horrible.
politics has to happen on a whole higher level. This is really
Right.
beyond what we can do. We could go on forever. There's so many things we could have talked about that I wanted to talk about, but we can't. This is a lot. Do you want to just give me a few, if you don't mind? Thank you so much, by the way. Do you want to give me a few take-home points? Just a few things you want people to leave with. Could be for parents of kids with autism, could be for everybody.
I think that what's going on now at the federal level is a travesty. I think that Kennedy is committing crimes against humanity by discouraging parents to be suspicious of vaccines. I have had one mom who took Tylenol during her pregnancy and was crying when I told her. I said, remember, this is the guy who told people that maybe bleach would cure COVID. So that made her stop crying. But that we're going to have a lot of dead kids who don't get vaccinated. We're going to have damaged kids who don't get vaccinated. Kennedy is completely blind to the spectrum of autism. He's completely blind to the medical research that's been done. And they're trying to turn the FDA into an echo chamber for whatever Truth Social would like an echo about this week. So I think that's a very dangerous thing that's going on, and for parents of kids who are at risk to have disabilities in their children, both physical and cognitive and autism. I think we had really good evidence that vaccines didn't cause autism. And I thought that the nail was in the coffin. Silver Stake was in the heart of the vampire on that one, when the class action suit going towards vaccine court disintegrated, because the key expert witness for the plaintiffs in that case was ruled not to be an expert witness by a federal judge. And all the ones that the drug company who had put on for that case, including myself, were considered to be experts. And that's who Kennedy has as the head of his commission. He fired all the vaccine experts and brought in his own vaccine experts. And so that's very dangerous, what's going on right now. But it's also, yes, question.
No, yes. But what I'm not hearing, and that's really important, is the reason they're able to do that is because of the mess that was COVID and the lack of effective communication about public health, including vaccines, and the attitude, I think, that we're just going to tell you what to do and you're going to listen to that. And so I was hoping after COVID, there would be a thinking about what we did wrong and trying to do things better. And instead, we've just doubled down on our polarization. And so what you're saying, I believe, is true. But I also feel for more and more parents that are getting skeptical because they don't know who to trust. What RFK is doing with his minions is he is building on that distrust. He is taking advantage of it. But it was there already for the taking.
Right. Oh, yeah. And he's building on it. And yeah, and in some ways you would say he's a good politician. He knows what you can exploit in terms of people's beliefs.
There's a vaccine group called Vaccine Talk, which has almost 100,000 members. And this group is a chance for people who are vaccine hesitant to ask questions without being judged and be surrounded with people who can give them accurate information. It's amazing.
That's
It's
great. No, that is
not an
great.
echo
And
chamber.
it's good to know that exists because I think that, so let me get back to the question you did ask me, which is that I would like to see an acknowledgement that we need in our society for kids with autism, um, a way for them to succeed as adults. We need more vocational education.
Yes.
We need more vocational testing. We need more, let's take them off of pure academics and put them onto teaching them to lay tile, wire pipes, work in landscaping. Let's see what they enjoy and then therefore grow their ability. And my motto in the Politics of Autism, talking about what I'd like to see for transitional age youth, is start low, go slow, but go as far as you can go.
What do you mean by start low?
In other words, for parents whose kid is failing out of one community college class after another because they can't get to the prerequisites to take any of the video gaming courses where you have to pass math prerequisites first, they shouldn't be doing that. They should be starting low. If they like, maybe I've had some who they work at a plant nursery and they learn that there's all these Latin names of plants and what the differences are. And they can take the new plants that are delivered and shelve them in a very competent way so that knowledgeable plant buyers can find things, and they might even be able to talk to the knowledgeable plant buyers about the differences. And then they move up in that world of work because they love the classificatory nature of plant species. That they should be doing this and not laying at home on the couch because they've 5 times failed the prerequisite courses that would take them to the holy grail of taking a video gaming programming class.
It's just not realistic for a lot of people. And it's the same thing for typical kids. It is exactly the
Yes.
same thing. We used to
Right.
have vocational programming, and you
Yeah.
don't have to track people where you're only for vocational, or you're only low this, or you're only high this. We just need to be realistic and honest and open our eyes to what this kid is passionate about, what their strengths are, what their weaknesses are for all kids. This is generalizable to all kids.
Well, this is a coastal thing, I think, more than the rest of America. So for a drug company, I did litigation support. And long story short, I ended up evaluating a boy in Bowling Green, Kentucky. And he was borderline IQ kind of guy and in high school in Bowling Green, Kentucky, you do 1 semester of learning to lay tile, 1 semester of learning to attach pipes to one another, 1 semester of learning how to cut lumber, et cetera, et cetera, et cetera. And he said, I liked the tiling, and I have an uncle And I told my uncle says, this summer you come work for me and we'll put you to work. To me, this is much better than a kid with borderline IQ, mom trying to get him to go to community college till he's laying home on the couch. And they need mentorship. Start low, go slow, let uncle have him just carry boxes of tiles because someone's probably the big strapping 19-year-old is going to be better carrying boxes of tiles than the tilers who are already 35 years old and have back problems. And then he can start laying some tiles, and then he can start grouting some tiles, and then he can start cutting some tiles. Let him start low, go slow, but then take him as far as he can go. And if he ends up working for his uncle, till he's 35, I don't see that as a tragedy because that young man will know he has the competence to do something.
So I really want to thank you so much for doing this with me. I have so much more that I'd love to talk about with you. Maybe we can do another one of these because I think we just scratched the surface of this. So thank you so much.
So I just want to say at the beginning, you did make one error, which is when you were talking about my credentials. I was involved in the DSM field trials for 3 and 4, but I was a field site coordinator. I was not the head of the trials. That's a big job, and that was not me. I was a field trial investigator for one of the sites that helps standardize the definition of autism in DSM-III-R and DSM IV.
Thank you so much for correcting me on that. Again, thank you so much for doing this with me.
Sure, no, it's fun. You're doing incredible work yourself. This is really important what you're doing. So I'll look forward to seeing how it looks.
Thank you so much. Thank you for listening to Kids Matter. Raising healthy, happy children takes a village, and I'm grateful you're part of ours. If today's conversation resonated with you, please share this episode with another parent, grandparent, teacher, or anyone who cares about kids. Together, we can build the supportive community our children deserve. I'd love to hear from you. Share your thoughts, questions, or suggestions for future topics at kidsmatterpodcast@gmail.com with no exclamation point. Your voice truly matters. Until next time, keep advocating for the children in your life because kids really do matter. They are our future. I'm Dr. Elisa Minkin, and this has been Kids Matter. Please note that while I am a pediatrician, I am not your child's pediatrician. This podcast is for informational purposes only and does not constitute medical advice. For any medical concerns or decisions, please reach out to your child's healthcare professional.
Okay.